Now, from CBS News Miami, this is Facing South Florida with Jim DeFede.
Welcome to Facing South Florida. I'm Jim DeFede, and this week, the 7 Republican presidential candidates not named Donald Trump debated on Fox News, and it was at times hard to watch. All of the candidates spoke over each other, the moderators never really established control, and even though they asked a number of good questions, they couldn't get the candidates to answer them. Nikki Haley had a good night, and Ron DeSantis did better than he did in the first debate. But does any of it really matter when Donald Trump is ahead by 30 points? After the debate, I spoke to State Senator Joe Gruters, the former head of the Florida Republican Party, and someone who has already endorsed Donald Trump.
They largely looked like a bunch of kids arguing. At times you couldn't understand them talking over one another. They weren't, I thought the moderators did a poor job of keeping control. And listen, I understand as a politico wanting to make sure that you get your voice heard. This is their one chance to try to stand out. But the question, did anybody stand out enough to make it worthwhile? No. I think that the RNC should cancel the rest of the debates. We have President Trump up by 40 to 50%. And there's no need to continue on this charade because none of these guys are even a factor at the end of the day.
Former President Trump has already announced that he will not be attending the third debate, which will be here in Miami in early November. Is that a mistake, though? I mean, I understand the politics of when you're far ahead, you don't usually engage in debates because there's a lot at risk. But isn't it important for Republican voters to hear from the former president on stage, showing them that respect to actually participate in debates?
I would say no, because people know exactly where he stands on the issues. You know, he, at the same time as that debate was going on, he was addressing the United Auto Workers and had a wildly successful visit to Michigan, which is still a battleground state. I think people know where he is. That's why he's still at 50% less. And all these other candidates are spending hundreds of millions of dollars to get to 10%. You know, the former president's at 50%. These guys are nowhere close. The President Trump is going to be the Republican nominee. And like I said, I think as a former member of the RNC, my advice to Ron would be to cancel that third debate in Miami, and let's move forward and let's rally around the president who's going to be our nominee and try to help him make sure that he's going to be successful against Biden in next November.
Obviously, you endorsed former President Trump early on. As soon as he announced, you were there. I remember seeing you at Mar-a-Lago when he made his official announcement. But I'm going to ask you the question, because I haven't had a chance to, that was asked at the first debate. Would anything change in your mind if Donald Trump was convicted? Now, obviously he's facing 91 counts in 4 different jurisdictions on different charges. But if he were to be convicted, a convicted felon, would that change your support at all for Donald Trump?
Well, who knows what's going to happen, because in some of these jurisdictions, I don't know if he's going to get a fair trial. And I don't think he should be on trial for any of these things. I think what you saw in New York with his business, they're saying Mar-a-Lago is worth, $18 million. I think it's vindictive. I think it's an organized effort to prevent him from becoming the next president. I think the deep state is scared of him. And listen, I'm not trying to protect him. If someone's guilty of something, fine. I think this is purely politically motivated to try to take somebody down. And I think what you're seeing is the base saying, what in the world is happening with our system? What is going on in America? We can't let this happen. And that's why the support for the former president is off the charts. And it's going to continue to move up.
One of the things that was interesting that sort of took place a little bit behind the scenes in the last couple of weeks here in Florida was there had been a loyalty pledge that was a requirement to get on the ballot. And I know that yourself and other Trump supporters maneuvered and worked to get that language stripped out, much to the consternation of Governor DeSantis, that wanted it in potentially as a way of blocking the former president from his name actually appearing on the primary ballot in Florida next year. Can you take us a little bit behind the scenes? What was going on there? What was at play with all of that?
Yeah, this was a very interesting situation because all of a sudden I got a call in June, I think, from the former president's campaign, and they said, "What's happening with the Republican Party of Florida?" I said, "I have no idea." They said, "Will you look into this new rule that they passed?" And what happened is the Republican Party of Florida passed a new rule in May. So this is not a long-standing issue. They put this new rule in May that basically said you had to sign a loyalty oath and you had to endorse whoever the nominee was, even if you were adamantly opposed to some of their positions and you didn't care for the individual, in order to get on the ballot. It's not to get on the debate stage like the RNC has a pledge that says you have to sign the loyalty oath if you want to be in the debate. They have another pledge that says if you want to get the data, you have to sign this type of loyalty oath. Big difference between that and in ballot access. Why would the Republican Party of Florida ever want to put up artificial roadblocks for any qualified candidates? And I told my colleagues, I said, if we prevent the former president from getting on that ballot, the Republican Party of Florida will not exist in 60 days.
So let me just sort of ask, do you believe that Governor DeSantis was behind that move to try to change the system so that he could potentially try to block Donald Trump from being on the ballot in the primary in next year?
I don't know exactly who was behind it, but I will tell you that it impacted one candidate. There's only one person that wanted to sign the pledge. And it's not about signing the pledge because the former president has signed pledges in like South Carolina. They've had a 20-year pledge. It's about putting up these artificial roadblocks and having these brand new rules, and it's not fair to the process. So we worked it. Listen, the governor's team worked it hard. The governor's team, they made calls. They had people at the meeting. As a matter of fact,
to keep that rule in place.
Working hard to keep that rule in place. But I think that the relationships and common sense prevailed. And listen, the people.
Well, let me just ask you. What does that tell you? You know, you say you don't know who was behind it, but what does that tell you that the governor's team was trying very hard to keep that rule in place against you to potentially keep Donald Trump off the ballot in Florida?
I think it was a horrible mistake on their part. The miscalculation. I think that they were probably given bad advice. And at the end of the day, what it shows is the party is still with the former president.
You've been open about the fact that because you are supporting Donald Trump, that as a state senator, you got whacked pretty good by the veto pen in terms of having a lot of programs and projects in your district vetoed by the governor, blocked out by the governor. I'm curious, as you watch this play out on national stage and DeSantis numbers continue to drop in the poll and the likelihood of him winning slips a little bit more every single day, I'm curious as to what you think, what kind of a governor do you think Ron DeSantis is going to be when he comes back to Florida if in fact he gets beat badly on the national stage?
Well, I think everybody is wondering that in Tallahassee. And the question is, does the legislature reassert itself and takes back the authority that maybe they've ceded a little bit? But I will tell you that the governor's done a good job of legislating. I think we've passed a lot of good policies over the last couple of years. And but, you know, I think he's going to want to have some type of legacy that works, because where does he go from here? Right? I don't know. I think that he burned his bridges with the former president. I think he burned his bridges with the former president's base and supporters. I don't think he can come back in 2028. So what type of governor will he be the last 3 years? I hope from a community standpoint that we can get over whatever disagreements we have in terms of my support or other members supporting him or not. Because at the end of the day, you talked about the vetoes that were slashed in my community. Those projects, it's like vetoing funds for disabled children, trying to help them get jobs, right? Vetoing a nursing program where we have such a huge shortage of nurses. Vetoing water quality projects that helps Sarasota Bay. You know, on and on and on. And the question then they go and talk about wasteful spending and everything else. And then you ask yourself, is funding disabled children's projects and helping them overall get jobs and become more successful members of our community, what's more important, trying to fund some project like that for $400,000 or spending millions of dollars flying these illegal immigrants from the Texas border all across the country? Not illegal immigrants in Florida, but illegal immigrants in other states. Listen, I'm the first guy. I passed sanctuary cities in Florida. I'm very strong on immigration, but it's he did not hurt me personally. He hurt Sarasota County and members of my community by doing that.
Why do you think he's failing on the national stage? He came in with such a head of steam after the November election that he won by 19 points, as he likes to remind everyone. What do you think happened to him on the national stage when we look back on his campaign?
I think he started campaigning.
That's it. The more people got to know him, the less they wanted to be associated with him. Is that what you're saying?
Accurate reflection of what's happening. Because look, how much money have they spent? 50 million, 100 million in the super PAC, and I think they've lost. I think I think they were 1 point away from the former president at one point, and now they're 40 points behind. I don't think that's going to reverse anytime soon. So we'll welcome him back to Florida, and we'll have him as our governor the next 3 years. And I hope that he'll continue to do the best job he can. But I hope that he, like I said, moves past the what I would call a vindictive stage of vetoing projects.
When we come back, we will talk to Miami Beach Mayor Dan Gelber about the rise in COVID deaths in Florida and why he believes the governor is more interested in saving his failing presidential campaign than in saving lives. Stay with us. Welcome back. As we discussed last week, COVID is on the rise across the country and especially here in Florida. Look at this chart. These are the number of people who have died in the past 3 months from COVID, according to the CDC. Florida is well ahead of even California, which has almost twice the population of our state. And the overwhelming majority of those who have died were either unvaccinated or never got a booster shot. And yet, as we have pointed out, Governor DeSantis and his Surgeon General, Dr. Joseph Ladapo, proudly announced recently that Florida is the first state in the country to reject the new COVID vaccine. Last Sunday, I spoke to Florida's former Surgeon General, Scott Rifkin, about the dangers of that position. And this week, I wanted to discuss it with Miami Beach Mayor Dan Gelber, who recently wrote to the governor demanding he do more to protect people.
Even with this governor's history, I was flabbergasted by what he said and what he did. During COVID, he tried to stop, and he successfully stopped private businesses from requiring their employees be vaccinated, the Special Olympics, the cruise industry. But this is a little different. Telling people not to take a vaccine when over a dozen people are dying every day in his state, I think I thought it was craven, because frankly, he was doing it simply to help his campaign for president and not because he cared about our residents. And I thought that was one of the worst things I've ever seen a public official do. Essentially, give people bad advice, deadly advice, because they have some other agenda in mind that they're following.
Why does this make good politics in his mind, do you think?
Well, listen, we are in an extremely divided nation, obviously, and his secret sauce is dividing people more and more and more, making them hate the other side. And right now, in Iowa and some of these states where he's trying to get votes from the base of the Republican Party, this might be good politics. I don't think it is, by the way, because I think people sort of recognize that vaccines are important in that they protect them. But for him, this may be a way to enlarge his base in places where he's hungry and I think probably desperate for votes.
You and I both recently spoke to Dr. Rifkin. We had him on the show last week. I know you spoke to him as well.
Well, remember, Dr. Rifkin was the Surgeon General under Governor DeSantis. It wasn't like he was from another administration. And he's a pediatrician. He's at Brown University now and doing public health. But I talked to him a lot in the throes of COVID, and I thought he was incredibly balanced and thoughtful, information based. He sort of feels like the kind of doctor you'd want to have as your own doctor. And when you talk to him, he just sort of explains it in very simple terms, in a way that I think people should hear. So for me, I just wanted our residents to hear from a doctor who's just calling strikes and balls, and just says, this is what's going on, this is what you should consider doing. And all I'm telling my residents to do is, I think they should consider taking the vaccine. I did, but I think that they should talk to their doctor if they're not sure. Listen, the problem right now in Florida is that you have the person with the biggest megaphone and the greatest influence giving people political advice about a healthcare decision. And I don't know how anyone in the world can say that that makes any sense at all. This is a medical decision. Talk to your doctor, talk to a doctor you trust, talk to a doctor who's calling it straight. Do not listen to the governor about this. He is not worried about you. He is worried about his campaign.
You and I have had this discussion before. So many people just want to put COVID not just out of their mind, but just completely out of any thought that they have going forward. And that's always the challenge here. The perception that COVID, that's something in the past. How do you challenge that? How do you fight against that?
It's interesting. I think about that a lot because, if 13 people a day die in Florida, if 13 people a day died in a mass shooting, we would stop everything to think about it and to do something about it. But somehow the fatigue around COVID is really something that I think is real. I think people don't really want to think about it. But I will tell you, though, that when you have it happening, you need to realize that you can stop it. A vaccine is the best way to stop it. And by the way, in the middle of COVID, I used in the video, and I always explain to people, in the middle of COVID, when really people were coming into the hospital in Dade County at 400 a day, 4% of them had their boost. In other words, 96% of the people who checked into a hospital did not get their booster shot. So if you had the booster, there's almost no chance you were going to get really sick. 75% had no vaccine. So, it tells you that the vaccine means something. So I think people have to be reminded about what they need to consider doing to protect themselves and their loved ones. And you have to sometimes really, say it loudly. It just becomes so much harder when the governor is telling people something opposite. Honestly, Jim, I talk to people all the time, not sort of radicalized, partisans, but just people who don't know what to do. And I think that's because they're hearing contrary advice about something that they should not be hearing contrary advice about.
Well, you've experienced some of this yourself in the sense of you posted this on Facebook, and I know some of the vitriol that you've had directed at you as if you were saying something heretical. So, what's been the reaction that you get? Obviously, what takes place online isn't real. Twitter isn't real. Facebook isn't real. I think we need to move beyond that. But yet it does indicate just that level of anger about science, the basics of science.
By the way, I've gotten hundreds. I posted this video where, I thought I was pretty balanced. I highlighted and focused on Dr. Rifkin's advice, and I thought it would be helpful to people to hear him rather than the current Surgeon General. I've gotten hundreds of comments. Probably 70% of them have an F-bomb in them, and or worse. And since it's a public place, I can't take them down. So it's there for everybody to see. But for every person who's just, I think, radicalized or just sort of nuts, there are a group of people who aren't, but are wondering whether they should do it. And that's the cohort we have to deal with, because you got to convince them that there's something there that they need to think about in an informed way. And look, when we have a hurricane coming at us, we tell people to evacuate because that's what they should do. If the governor said, don't evacuate, and I said evacuate, I don't know what people would do. In an emergency, your leaders are supposed to get on the same page and give you the advice that you ought to be taking, not give you contrary advice, because then all of a sudden the marketplace of what people are going to, becomes confusing. And a lot of people, I think, are confused right now. And I think that's probably why Florida leads the nation in deaths and has the highest rate of hospitalizations.
This becomes their identity, is to be anti-vax, is to be anti-science. It's not even grounded in a belief system in something. It's just a skepticism about everything that has been engendered by a lot of politicians to not trust anyone, not trust the media, not trust science, not trust doctors, because if there's no one to trust, then it's easier to lie to people. But it seems to me that that's a big part of the problem that we've got right now.
Yeah, and by the way, it's really, look, it's part of obviously politics these days. People who can become successful in politics by simply, creating as much and as deep, the deepest divisions possible, and reaching out to your side. And that happens about almost everything. We're seeing it play out in our public schools. We're seeing it play out everywhere. But when it plays out in healthcare, it has a different repercussion because what happens is people don't do things that they should be doing. Here is the very sad truth about this. If the vaccine, if the boost is the best way to avoid getting sick and dying, there is no question that if more people took it, less people would die. So there are people dying every day in Florida simply because they're not getting the vaccine. And you're the governor of this state. How do you try to make that a larger number of people dying by simply telling people not to get the vaccine? It is so incredibly irresponsible. It's hard to even put words to it. And so for me, at least, I don't want my residents I don't want them to be confused. I want them to hear from doctors, their doctors, Dr. Rifkin, and unfortunately, though, it does feel like you're screaming into a storm, because Governor DeSantis has unquestionably got the biggest megaphone in the state. Fortunately, and it's weird that it's fortunately, half the state probably despises him at this point. So maybe at least half of the people will take the vaccine because he's telling them not to. But what a horrible way to govern, right?
The irony is it's his supporters who believe him who are most likely to be affected by it, and who are taking a risk of being hospitalized or dying as a result of following his policy.
No, and I think that's sort of proven out. Listen, before they stopped giving it to us, they would tell us the mortality rates in Dade County. And my city, I was very proud in the middle of COVID, had of the 10 biggest cities, had the lowest mortality rate. I really believe it's because they were following healthy practices. But I think Hialeah easily had the highest mortality rate by quite a bit. And I've got to think some of that is listening to the leaders they trust tell them wholly untrustworthy things about what they should be doing.
We'll be right back. Thanks for joining us. You can follow me on the app previously known as Twitter @DeFede, or email me at jdefede@cbs.com. We'll be back again next week. Thanks again for watching, and enjoy the rest of your day.